Diagnosis of hair loss. The diagnosis of hair loss is a multifactorial process, and it first usually begins with getting a person's history. What exactly happened? And this is always sometimes more challenging than others. But when I see an individual with hair loss, the first thing I have to ask is, why are you here? And when did it start? So a person may say, well, I've been shedding hair for 6 months. So it's important to know that that occur in association with any changes in their diet, weight, any other medical issues that are going on. During the COVID-19 pandemic, many individuals start losing hair as a consequence of the fevers they went through, the vaccinations. Did vaccines cause hair loss or issues? Many patients had unexplained illnesses or changes in their symptoms. With the long COVID, some people are still shedding hair a year or 2 years after they recovered from COVID. So those kind of things go into diagnosing hair loss as far as medical issues are concerned. Looking at the scalp itself and just seeing what's there. Some individuals have hair loss and the scalp looks perfectly normal. The scalp can be described as burning, stinging. It feels like it's on fire. How can a person feel like their scalp is on fire when there's nothing to see? That can require doing a skin biopsy to see what's actually going on under the skin. So there's a condition called lichen planopilaris that can show up with just pain, burning, and it's an altered immune system. Other changes you can feel indentations in the scalp where there's a loss of tissue or fat or atrophy. Those kind of conditions require doing a skin biopsy. And so putting all these things together by what we see visually, what the scalp feels like, what the texture of the hair is the hair shedding and coming out excessively, the tips on the end of the hair, whether they're white, black, or different things. So these are all the different things that go into diagnosing hair loss. Are the eyebrows still there? And these other parts of the eyelashes. So hair loss diagnosis goes into all of those factors as well. So when a person needs hair loss evaluation, it takes time. It's not always possible to just look instantly and say why a person has this condition. But the biggest challenge for me is that most people, when they walk in with hair loss, their whole focus is, okay, how am I gonna get my hair to grow back? I said, have to slow you down. We can't say how to get your hair to grow back until we know why it's coming out. And there are multiple possible diagnoses. So the evaluation can, like I say, involve biopsies, it can involve blood work, and it can involve the medical history. So getting all those things, putting them together, sometimes it takes several weeks, or it can take a month or longer to get special studies done to really come up with the accurate diagnosis. And then it's time to talk about treatment and what can be done to help correct the problem. You want to be part of the solution for helping individuals with hair loss get the professional care and guidance that they need. Go to NACMHP.org and provide your email address to get our free report and ongoing updates to be part of the community that helps solve this problem. Go to NACMHP.org, give us your best email address, and we'll send those reports to you right away and get you on the list.